Hi, this is Don Kettle, and I'm at the LBJ School of Public Affairs at the University of Texas at Austin. And with us for this conversation today is Mike Nichols, who is the president and CEO of the Coalition for the Homeless in Houston. Just a quick note of background, and Mike will be talking more with us about the issues and the problems and the challenges that he's been facing. But of all of the efforts to try to reduce homelessness and to try to deal with the folks and help the folks who are experiencing homelessness across the country, the effort in Houston has been one of the very most successful. It's shown a dramatic improvement in the efforts to try to help those experiencing homelessness, and it's been built largely on the backs of a very robust coalition of scores of community organizations that have been responsible for being able to provide an effective response. And so, Mike, we want to talk a little bit today about not only the efforts to try to deal with homelessness, but also what you think the lessons for public policy, and especially in this COVID crisis, might be from the experience that you've had. Could you tell us a little bit about that?
So what I'd like to do, if you don't mind, is give a little bit of background
Sure.
about the coalition and the success in Houston. In 2011, Houston was identified by HUD to be a city in trouble with homelessness. Simultaneously, we had a new mayor, Anise Parker, who had had personal experience through her foster children with homelessness. And those two things came together with a commitment to reduce homelessness. Um, Mayor Parker put together this group of people led by business people and government funders. And in 2011, the Way Home was established, which was a part of the HUD process of bringing together public funders, private funders, government agencies, and nonprofits. And the idea was, how do we increase the people housed? And this was early on in the commitment of housing first. And the process was, if you want to end homelessness, the first obvious thing is to house people. And so this process went into play. And from 2011 till 2018, even with the impact of Harvey, 18,000 homeless people have been housed in supportive housing. Now, supportive housing, as everybody knows, is housing plus wraparound supportive services. This was done by making sure there were adequate housing vouchers from the public housing authorities and adequate services by our nonprofit service providers who would put together these services around the people housed. The remarkable thing about this was 85% of the people in this 18,000 group remained housed. The way we track them is that it was they had to be continued to be housed after 2 years, not in the hospital or in jail. 85% have been housed. That number on permanent supportive housing has been up to the mid 90%. And again, very impressive. The success is there. It's proof along the public policy issues that housing first works. And it's proof that you can actually drop the number of homeless people. So in Houston, under the HUD point in time count, which is a few days a year where there's actually communities go out and count homeless people across the country. We have dropped from over almost 9,000 homeless people to less than 4,000 today. Now that's remarkable considering the inflow of homeless people into our urban areas, the broken systems that have produced so much homelessness. And I don't want to stop without mentioning those broken systems. We have Texas Department of Corrections who release about 45,000 people a year. 10,000 show up in Houston, and they are released without housing, without IDs, without jobs, with no support at all. We have a broken mental health system where of the 9,000 releases from Harris Psychiatric a year, 3,000 of those people, 3,000 of those releases are to homeless people. I want to make sure that I do not stop without blaming the state government of Texas, especially under Greg Abbott and Dan Patrick, who have refused to expand Medicaid, which would have solved many of these problems, who have refused to really put any kind of support systems in the Texas Department of Corrections, even the most minimal. Letting someone leave the TDC without an ID is inhumane and a set for faith. But Houston's had successes even with those broken systems. So the question is, what happens now during this coronavirus? And Dr. Kettle, if I could move to that, I'd like that.
Sure, that'd be great. It'd be worth pivoting from the kind of success you've had so far to the special issues and questions that now the COVID crisis presents. And there have been all kinds of conversations about social distancing, about standards for washing hands, and lots of other things that just turn out to be far greater challenges for those experiencing homelessness. So it'd be worth, I think, talking some about that, Mike.
Yeah, no, again, it's very significant. And one of the things that we had to do is pivot some from our hard line of saying, let's spend all the money we can on housing first, because money spent letting people live in encampments is not the way we ought to do that, because that's just a temporary solution. But the truth of the matter is, there are about 4,000 people currently in Houston living either in temporary shelters or emergency shelters, and they need help. One of the things we've done is we've asked the business community under the Downtown Management District and city government to put in hand washing facilities. And 19 hand washing facilities have gone up around Houston, not only in where the encampments are, but also where homeless people can be found during the day. The problem has been that our current system of trying to house people is offline, because it's hard for our outreach folks to go in and find folks. We were lucky, very fortunate, in that the months before this crisis, we housed 200 people in the downtown area through funds that we received through the Harvey disaster relief. Again, I want to say to the folks who are in public policy, we have a big problem in Austin. The General Land Office under George P. Bush is holding millions and millions of dollars of disaster recovery relief from Harvey, and are not releasing those funds, particularly to homeless people and homeless organizations in the city. And it's a travesty that they hold those funds instead of letting local governments handle that. And maybe that's the issue around this that we can go to first, is the importance of local governments. The city of Houston in Harris County are working with us daily to try to solve the first problem. The first problem is, what do you do with a homeless person who tests positive for COVID-19? What do you do with a person who is hospitalized and then after 4 days is treated and can be released, who is homeless? How do you quarantine yourself when you're homeless? And at this moment, and again, like all crises, the obvious comes to rest. We do not have a respite facility, and have not had a respite facility for over a year for people leaving hospitals. So for the last year, because of a failure in government funding, federal funding, when people left hospitals, public hospitals, and Texas Children's and Methodist, and they were released from having heart surgery or a knee replacement or I'm drawing a blank for the if you have your stomach your colon taken out. if you have those kind of serious surgeries, they were released to the street, and because there was no respite care. Public policy question: who should pay for that respite care? In Houston, we have the Harris Health System that is overwhelmed with indigent care and being paid for 100% by county funds because what? We have no Medicaid expansion. So I think it's not right to ask them to do that. The hospitals in Houston, with hundreds of millions of dollars of charitable funds, have refused to step up to the plate to do anything to help homeless people, even the ones coming out of their hospital. So we have no respite care. The county and the city this week both committed to $1 million each to rent motel rooms and put in an operator to help these homeless people who either tested positive for COVID-19, who are coming out of the hospital, or who have tested and are awaiting results. We're trying to set that up. We have motels in line. The question becomes, who operates that? During Harvey, the homeless solution system operated housing for homeless people, temporary housing for homeless people. It was very difficult. But this is a healthcare crisis. It's not a homelessness crisis.
And Mike,
we have not. Go ahead.
Yeah, and let me try to ask you if you could kind of paint the picture about how you're attacking this crisis. One of the things that I've been struck by in reviewing some of the work that you've done is just how large of a coalition that you put together. After all, you're head of an organization called Coalition for the Homeless. You don't provide the whole range of services yourself. Your job is to pull together this coalition. So could you remind me about how many different organizations you have that are part of this coalition?
Sure. So the Coalition for the Homeless is made up of 100 organizations, and it actually is structured with 2 different board of directors. We have a board of directors for the 501c3 whose responsibility is the sustainability of this intermediary nonprofit, making sure there's funding for the 25 employees who run the nonprofit, make sure the governance is there for that nonprofit. Then we have what's called a Continuum of Care Steering Committee. The Continuum of Care Steering Committee is chaired currently by Tom McCaslin, who is head of the City of Houston Department of Housing. It is made up of about 30 different individuals representing nonprofits, service providers like Search, Star of Hope, and New Hope, and other nonprofits, Avenue 360, other nonprofit service providers. We also have public funders. Public funders include the Department of Housing for the city and the 3 counties. Public funders include the Community and Service CSD's department in the 3 counties. Public funders include the folks who run the domestic violence funding in each of the counties. And then we have private funders who also participate. Currently, it's Rockwell, and they help lead this coalition. So again, with the 3 counties, with the city, it's about 30 individuals representing 30 different organizations. However, the coalition has 100 members in our coalition. Again, service providers, nonprofit funders, and government entities who deal with homelessness. And we see ourselves as the conductor of this homeless symphony orchestra. And if you think about it, it's a conductor because of the different interests, but probably the main issue is this conductor because of the complex financing. So what's it take to get a homeless person housed? It takes a housing voucher, which would come from a housing authority, depending on where that person is. One of the things about about housing authorities is they're very geographically limited. The City of Houston Housing Authority only can house people in the City of Houston. Harris County can only house people outside the City of Houston. Secondly, it's about funding for those services. Much of that money comes from HUD COC funding, but some of it comes from other groups like ESG and other kinds of funding. Some of it is HUD funding through the state and through the city and through the various counties. But again, so folks will know, no actual city money, no actual county money is used to house homeless people. At this point, it is all federal money and private money that does this, although some of it comes through city, county, and state.
Yeah, and this is just an amazing story. And in the few moments we have left, I want to try to ask a kind of capstone question, which has to do with two big problems. One, you've got 100 organizations that are involved here. How do you get people just to keep coming to the meetings? Because that's a large group to try to coordinate. And then the second is, what kind of dashboard do you have? How do you know that you're making progress? Those are big and broad issues and questions that I think have much broader implications. So
let me start with the second. Let me start with the second because that's easier. The coalition from the very beginning was committed to being data focused. One of the things we have is we run the HMIS, the Homeless Management Information System, which every person who comes into the homeless system who asks for request any part of that is put in the HMIS system. It is a great system that we have great detail. About 50,000 individuals a year will come into the HMIS system. We're able to keep track of what services they've asked for, what services they've received. And although we wish it was tied to the medical systems and to the criminal justice system, we still get a lot of information. It's very, very helpful. That data, along with the data about the people we house, drives this organization. We are a data-rich, data-focused organization. And that's very much who we are. And there is money spent on that data, and that's a good part. And those dashboards are available on our website for the public. We try to be as transparent as possible with that data. And again, it is an ever evolving work that needs to be continued. One of our disappointments at this point is I wish I could predict what is going to happen with COVID-19, with the economic crisis, and the impact on the homelessness going forward immediately. And I don't have that answer. I'll give you just a quick item. The Harris County Jail, which has about 10,000 inmates at this moment, is going to do a humane release of individuals during the crisis, which is the great thing and the right thing to do. I wish I would know what the impact is on the homelessness system with that release. I don't know. The question about getting people involved, it is a difficult question. There are two sides to this. One is when we're giving out and distributing federal funds, an organization has to be fairly sophisticated in order to get those funds. They have to be strong financially. They have to be strong organizationally. And although we work diligently with organizations to strengthen them, it is an issue all the way going through. So you have these organizations that play a big role, and then organizations that may play a smaller role. And how do we engage those organizations who do feeding in the encampments or other ways is difficult. We have work groups based on activities, and that's been successful. And then every 5 years, we're committed to do a major 5-year plan, which is when we bring in all of these groups to help build out this plan. I mean, annually, we've tried to have special meetings with this group. For your folks, I will tell you an issue that I think I'd love their help with, which is how do you engage people actually experiencing homelessness, people with lived experience? Our COC steering committee has 2 members, or supposed to have 2 members with lived experience. It's important that we get that perspective. It's very difficult to actually do that. And we continue to work on how to do that. Folks who are dealing with youth homelessness very much need and want young people with lived experience to help tell us, what do young people want? Do they want to live in scattered housing or congregant housing when they come out of foster care? That's work that needs to be done, but I would say that's where we've been least successful in bringing in the support we need and the input we need.
Yeah, Mike, I just want to thank you so much for this conversation today. You've touched not only on so many issues about creating and building and driving a coalition to try to address one of society's biggest problems, but also figuring out how to try to connect it to the COVID crisis that we're all struggling with today, especially with some of those who are affected maybe the most with the least resources to try to respond. So I really appreciate this conversation and the chance for us to be able to share this more broadly.
Can I give one last pitch?
Absolutely.
What we know, and what the people at LBJ and other both public housing and public health and public policy know, is that we spend a huge amount of money on our healthcare system. And we know that it impacts only 20% of the actual healthcare, well, 80% of the healthcare is impacted by social determinants like housing. If I could say one thing during this crisis, if we had housed these 4,000 people for a mere $18,000 per year, we would be saving tens of millions of dollars, because they would be housed instead of doing this healthcare emergency. I hope that our country and our public policy leaders realize that housing people first is the answer, not waiting to spend so much of this money on healthcare, which wouldn't need to be spent if people were quarantining themselves instead of having to deal with the aftermath.
Yeah, that's a great point to end on, Mike, because one of the things that clearly is being focused with this debate is what we could call almost the problem of social discounting. I mean, how do we try to make the investments up front to try to save not only money, but also the enormous social impacts on citizens later down the road? And that's something that those of us in the public policy community are going to have to try to look at as we think about what the broader implications are of COVID-19 for all of us in our communities and for our country later on. So thanks so much for this conversation today. Truly grateful to you, and we will share this more broadly. I know it's going to start a broader conversation. So thanks again.